As we look at integrating back into society, with all the social distancing and isolation for almost 2 months now, and what the new normal is going to look like, and we've talked about structure, we've talked about purpose, we've talked about different CBT techniques. The reality of it is, you have to put all that into play, or at least be thinking about that, before you just open your front door and go back to normal life. Again, there's a new normal now. The reality of it is, if you struggle with anxiety or depression, this is a very scary time for you. It's very unsettling to walk into a grocery store if you have an OCD diagnosis, or even just anxiety or panic attacks, and to feel safe, around all the fears that have been brought up in the course of this whole COVID-19. So I think it's really important, beyond structure and realizing there is going to be a new normal for quite a while, beyond purpose, is how you integrate yourself back into society. And that includes things like mindfulness and deep breathing. It's about being proactive, setting yourself up for situations to not fail, to succeed. And if you know you're going to go in or leave the home or be engaged with, I think the best advice I can give you is to try to be proactive and not reactive. The reality of it is, it's not any one of those things. It's not structure, it's not purpose, it's not CBT techniques, it's not trying to engage socially with others. It's really that entire carousel of ideas, and being proactive about them based on your situation. Meaning, if you know you're going to be going into work and you haven't been there for 2 months, number one, there's some mental preparedness to even the idea of going back to work. Once you've mentally gotten over that hurdle, you also then have to work on your different ruminating or obsessive thoughts. And again, using CBT techniques, using structure, using other forms of resources, and less social isolation, to get yourself not just over that initial hump, but get over the humps that are going to come day by day. That said, just like the idea of getting over that kind of first hump, it will get easier over time. So if we understand we're more proactive and we're structured, we find some purpose, we understand there's a new normal, and we integrate those different therapy techniques that you've learned in the past, or can look up and teach yourself, or use an app to help you with, you're going to be more inclined to succeed over time, as compared to find yourself where you've set yourself up for failure.